Hello everyone, in this video we'll be discussing a mnemonic to help us remember the classic triad of normal pressure hydrocephalus. Now the mnemonic is going to be wet, wacky, wobbly. Wet is going to refer to urinary incontinence, wacky is going to refer to cognitive impairment, and wobbly is going to refer to gait abnormalities. So patients who have normal pressure hydrocephalus can present with urinary incontinence, cognitive impairment, and gait abnormalities. And we can remember this triad with the mnemonic wet, wacky, wobbly. Now, normally we have the choroid plexus within the ventricles of the brain that is going to be responsible for producing CSF. And the CSF is then going to return to the bloodstream through the arachnoid granulations. In normal pressure hydrocephalus, there's going to be this impairment of the return of CSF to the bloodstream. As a result, the CSF is going to accumulate within the ventricles. And when it accumulates within the ventricles, it is going to cause ventriculomegaly, or the enlargement of the ventricles. So here we have a MRI of a patient with normal pressure hydrocephalus, and we see ventriculomegaly. Now, when the ventricles enlarge, it can compress the brain tissue, and this compression of the brain tissue can then give us the classic triads of urinary incontinence, gait abnormalities, and cognitive impairment. The most common treatment of normal pressure hydrocephalus is going to be surgical intervention. We can give patients a shunt, a ventriculoperitoneal shunt, that can remove this excess CSF and return it to the abdominal cavity.